Ulthera is an ultrasound therapy treatment that focuses the ultrasound deep into the dermis of the skin to target the area normally targeted by a facelift. It channels through the skin without damaging the epidermis, creating deep channels of ultrasound to lift and tighten. This effect happens without any damage and so no downtime. The preparation for this is very simple, and the skin is cleansed and marked out in a grid formation so that we can accurately target the areas we want to tighten. The ultrasound causes collagen synthesis. It allows the collagen to reorganize by laying flat within the epidermis. It also tightens the collagen and helps the existing collagen to be renewed and strengthened. As collagen degrades in the skin as we become older, the fibers of the collagen, where it was once tightly coiled, becomes loose and slackened. The ultrasound therapy helps to target this collagen, making it recoil, tighten and firm the skin. The Ulthera device uses an imaging system called the Deep Sea, and this imaging device allows precise energy delivery. This precision gives added safety, allowing the practitioner to target the right areas of the skin with the focused ultrasound. It also helps us to avoid areas where we don't want to deposit the focused energy. For example, along the jawline, the area of skin is slightly thinner, and to avoid depositing the energy on the bone, which would be painful for the patient, we can move the transducer so that we can see the right area to treat using the imager. So we use all three transducers on quite slackened skin because we want to treat the energy throughout the different areas of the epidermis, from the deepest right through to the shallowest areas, allowing the most amount of tightening. So the typical areas that patients want to see tightening is quite often a full face and the neck and maybe the décolletage. But we can also break that down into individual requirements. The most common treatment that I perform is actually the lower face and upper neck to help tighten the jawline and the jowls and under the chin. We can also do smaller treatments like a brow lift. It's very successful for those patients that either don't want anti-wrinkle or the anti-wrinkle isn't appropriate for them. We can use the ultrasound to help to raise the eyebrows. So the amount of tightening and toning of the skin hugely varies from person to person. It also depends on how much natural collagen is present in the tissues already. So the better the quality of the collagen already in the skin, quite often the better the outcome. The treatment itself is quite quick in nature, typically around about an hour to 90 minutes depending on the area of skin to be treated. Ulthera does have some contraindications, so reasons why you couldn't possibly have the treatment, and these are all spoken about very carefully during consultation. The main ones being insulin-dependent diabetics, patients that may be pregnant or breastfeeding, and those patients that may have heart issues or metal implants. But all of this has gone over in consultation where it's explained thoroughly. As the energy is processed through the dermis and the collagen synthesis begins, there can be some discomfort, and this feels like a prickling energy sensation within the skin. The treatment area is treated over and over again until the right amount of energy has been processed into the skin. A warm sensation and a bigger tingle can be felt, but we do help you to manage this as the treatment goes along. It's usually a one-off treatment, so you'll have your treatment and there's no follow-up. You don't need to have repeat treatments. And the other thing that I think patients like more than anything else is there's no downtime. Some patients find that they have an immediate tightening in the 2 or 3 days after the treatment, but the biggest results are usually seen 2 to 3 months after treatment as the collagen renews and tightens and the skin starts to firm. Once you've had your treatment, we've kind of turned back the time a little bit according to the collagen, but this will then continue to age along with your natural aging process. So some patients may like to have a top-up treatment every year or every 18 months to continue that collagen synthesis.